Talking about this company called OpenEvidence. It's an AI co-pilot designed for physicians to increase accuracy for care of patients. The company says about 40% of the doctors in the U.S. right now are already using the chatbot. The product is free of charge for healthcare providers and is like a ChatGPT for doctors. The company has a $6 billion valuation. OpenEvidence founder Daniel Nadler joins us here at Post 9. Welcome.
Happy
to
be here.
You. When Ken Moelis says, I met a brilliant founder, we wanted to hear what it was all about.
He's a brilliant investor.
And you also have Jim Breyer and a number of other names that we know here at CNBC.
Kleiner Perkins, many, yeah.
So what do you do? What is OpenEvidence changing about doctors' offices?
Well, first off, so OpenEvidence is a AI co-pilot for doctors that helps them make high-stakes clinical decisions at the point of care. But I think, let me put this into perspective. So a lot of AI, when I hear AI talked about, is discussed speculatively or as if it's in the near future. This year, more than 100 million Americans are going to be treated by a doctor using OpenEvidence. So AI is here and now, especially medical AI is here and now. In October alone, we saw 17 million AI clinical consultations from logged-in, verified U.S. doctors and other healthcare professionals. So I think medical AI especially is evidence that our nation's investment in AI infrastructure is paying dividends already in the United States and globally for humanity.
How do you track the outcomes for patients?
Well, so OpenEvidence is not making medical recommendations. The key to our philosophy is that the doctor is always the last mile. So this is actually a really relevant setting to think about that. You can think about the history of the Bloomberg terminal or other financial software. The trader is always in the driver's seat, and the trader is ultimately making the trading decisions. And I sort of came from that background. My first company was on Wall Street.
Kensho, which we know we used to use for data.
Absolutely, and that's the sort of philosophy with which we come to medicine, which is that the physician always needs to be the last mile, but we can build and we can use AI and use technology to build force multipliers and brain extenders and help and assistance to them making high-stakes clinical decisions.
Do you see a point where the streams get crossed and the last mile is not the doctor?
No, I don't think that's realistic. I think quite the opposite is happening. The U.S. government is projecting a shortage of 100,000 doctors by the end of the decade. So we're actually struggling with too few doctors, and the doctors that we do have are increasingly burnt out. They're forced to drink from a fire hose of too much medical information. They're forced to see too many patients. COVID obviously did a number on the medical community. So I think the opposite is happening, which is the doctors that we do have are looking for force multipliers, and AI is the sort of latest entrant in that.
Right. I guess my question, though, was when the final decision is not the humans, but you're relying on a computer which ostensibly is smarter than even you are. You don't think that's going to happen?
I think a good framework for thinking about this is computers have been able to land planes for a very long time. If you talk to any experienced pilot, they'll tell you the computer can land the plane, and some pilots will admit, if you sort of get them in a friendly discussion, that the computer might be able to land the plane more steadily than they can. And yet, all the cockpits I've sort of peeked into still have pilots in them. I think there are other considerations simply than computing capability that go into whether we want a human as the last mile.
What's your competitive mode? I mean, what stops Alphabet from just saying, we're going to put a team against this because this is an interesting opportunity and potentially eroding your market?
Alphabet's an interesting example because our largest investor is Google. And it's, I believe, one of Google's 3 largest private market investments that they've ever made, the others being One Medical and Uber through Google Ventures. I think, look, from our perspective, we build specialized tools for professionals, and we build OpenEvidence from the ground up for doctors. I think the large companies, the large AI labs and the Mag 7 companies are obviously extremely well positioned to build things horizontally, but focus is very valuable in business and in life and certainly in technology. And we wake up every morning thinking about nothing other than how to supply a physician at the point of care with an accurate medical answer to improve their patient outcome. If you are one of the big AI labs, or if you're one of the Mag 7 companies, you have to build AI very horizontally. You have to serve someone writing a birthday card, someone writing an email, all of these things. We don't. And that focus gives us an enormous competitive advantage.
And what's it trained on? The medical journals, all the data?
So the other competitive advantage we have is we have strategic partnerships with the New England Journal of Medicine, the American Medical Association, NCCN, and the ACC, which are the two leading medical societies, and cancer and heart disease, which are the leading causes of death in the United States. So one of the things that we did right early on is we formed early strategic partnerships with the sort of gold standard sources of medical knowledge, and then we train on that. So that gives us quite a moat, because a lot of these horizontal AI applications are trained on the open internet, and that's good for seeing the sort of full distribution of human language. But ours are trained on peer-reviewed medical journals from the gold standards of medical knowledge.
Well, Daniel, it's great to meet you. Well, to see you again. I guess we saw each other for Ken Show and follow OpenEvidence. Thank you for joining us.
Thank you for having me.
Daniel Nadler of OpenEvidence.